Hello, everyone. My name is Javad Parvizi. I'm a professor of orthopedic surgery at Acıbadem University in Istanbul. I have the distinct pleasure of talking to one of my great friends and one of the brilliant surgeons in the field of orthopedics, Dr. Akosh Zahar. He is a fantastic surgeon scientist who practices in Hungary. I've been fortunate enough to visit him recently when he was the president of the Hungarian Orthopedic Association's meeting, and he's been a great friend to me for the past 2 decades. He practiced in the clinic before going to Hungary, and he is extremely experienced in the one-stage exchange. Because of that, first of all, welcome, Akosh. And because of that, he was assigned a very tough question in the ICM. Can you do a one-stage exchange in patients with fungal PJI? Akosh, welcome. And what do you think?
Hello, Jay, and hello, everyone. Thank you very much for inviting me to the whole ICM process, and especially for this podcast. And thank you very much for your kind words about my person and about my activity. So, one stage exchange is a very popular topic recently. I can remember 15 or 20 years back, no one wanted to do one stage. All the surgeons were for two stage, and only few centers in the world were ready to go for one stage revision arthroplasty in prosthetic joint infection, of course, in bacterial infections. And some centers were brave enough to establish a protocol also for fungal infections, like Endoclinic in Hamburg, where I had been working for a long time. And fungal infections is kind of special because the host is mostly immune compromised, and the fungal germs are not so easy to find. So when you make diagnostic procedures like culture, you have to think about the possibility of fungals, and you have to go for special broth and special techniques in the lab to find the bugs. And on the other hand, you need also special knowledge of microbiology and infectious disease specialists who can deal with fungal infections and to find the proper antibiotics. So the idea was to implement the protocol which was ready for bacterial infections for one stage revision to the fungal infections. And that was the idea behind this question in the ICM.
Yeah, fantastic. Those are really great points. So fungal infection happens in hosts that are compromised. Isolating fungus is difficult. And then fortunately, it's rare, but when it is there, we all know that treating patients with fungal PJI is a tough one. So do you do one stage exchange for patient with fungal infection at the moment?
Yes, sometimes for special cases, I go for one stage. When we have a good situation in terms of soft tissue coverage and the host is in a good shape and immunocompromised, but all the concomitant diseases are under control.
Mhm.
And we have a clear evidence for the infection with the positive culture, with the fungus. And we have also good antifungals for both IV and local use. Then I go for one stage, yes.
Got it. Perfect. So during the consensus, one of the questions we discussed was if there were any absolute contraindication, and the answer was no. So by definition, people don't see fungal infection as a contraindication. That question got 90% agreement, but your question was over 60% agreement. What do you think is the hesitance of people wanting to do one stage exchange in fungal PJI?
Yeah, this is a very good question. I was thinking about this, but fungal infection is a rare condition, as you mentioned, and a lot of surgeons didn't treat patients with fungal infections in their careers. So only few of us were fortunate enough to see such conditions and such patients for treatment. And a lot of surgeons are still afraid of fungal infections. And they say two-stage exchange is a safe method, and we have time for diagnostics. We can take a lot of samples. We have a second chance for debridement, and maybe they are more comfortable with this. And there is also a group of surgeons who say difficult to treat germs and maybe fungal infections are difficult to treat, um, are not okay, are not the best cases for one stage revision. And that's why they are struggling with this question, I think.
Yeah, I agree. And I think some of our, obviously, over 200 attendees were infectious disease doctors. And I wonder if our infectious disease colleagues also feel somewhat hesitant and concerned about doing a one-stage exchange in patient with fungal infection. Because with the fungal infection, we need to do like prolonged course of antimicrobials, 3 to 6 months. And I know that for sure, one of my infectious disease colleagues in Istanbul is very hesitant to have an implant put in a patient with ongoing fungal infection. I wonder if they also voted against that at that point. But yeah, I think you make a great point. So, Akos, you did an unbelievable job. You led a very, very big group of people, delegates, to do this. It was a spectacular show. You were brilliant in presentation. I wonder if you have any messages or if you have anything to say about the ICM, what that our audience would like to hear from you.
Yes, I think ICM is a very good opportunity to get together with specialists from all over the world, both with surgeons and infectious disease specialists, and also from researchers from basic science, which is very useful for us. And we can find the answers to questions which are maybe not so obvious for us in our daily practice. And there are a lot of questions where I was not able to give the answer right away. So I had to think about it, or I had to read some papers about this topic and go deeper in the topic. So for me, it was a very good occasion to learn a lot of new things, to discuss, and to convince my colleagues about my point of view, especially in one stage revision. So it was a very good scientific impact. And on the other hand, it was also a very good occasion to see friends and exchange our thoughts beyond the Congress.
I agree. I learned a great deal also. Talking of friends, I will see you in November in Antalya. I think you're coming to Totbet to lead a session, Hungarian and Turkish collaboration. Thank you for your friendship. Thank you to your dedication. Thank you for teaching us, for being a fantastic surgeon educator. And it's always a pleasure to see you. Thank you, Akosh, and good day.
Thank you very much,
Thank
and
you.
good day, Jay. Thank you.
Thank you so much.